All right. And welcome everyone. So welcome everyone. I forgot to ask the County of Riverside for a bio to introduce everyone. And so I'm going to have to put a bunch of people on the spot to introduce themselves from the County of Riverside.
Okay, well, Allison is here, and she may have a compatriot or two. So
yeah. I'm super excited that you asked us to join today, and I got to see a little bit of your passion for the last 3 or 4 minutes. That was great. Yeah. So good evening. I am Allison Gonzalez. I am an assistant director for Department of Social Services for Riverside County. And Department of Social Services has a couple of different divisions. We have our children's services, adult services, kind of our admin and financial services. And then our team, which is self-sufficiency. And our self-sufficiency division has a variety of different programs that we administer. And I brought 2 amazing staff with me today who are going to share a little bit about those programs and how we bring awareness to the communities about them, educate our communities on the programs and ways to access programs, and also how to stay on our programs. And I'll pass this over to Joy, who is our manager over our community outreach team.
Thank you, Allison, and good evening, everyone. Thanks for having us this evening. My name is Mary Joy Go, and I'm a regional manager for Self-Sufficiency. I oversee our community outreach branch, and we also have a team that supports application from our jails, day reporting centers, probation, and REHS hospital. And so let me go ahead and share my screen so we can start our presentation for you.
let me make sure I've got it set up so you can share. Hang on one sec.
Okay. Yeah, it told me disabled, so I will.
I think you can do it. Try now.
Okay. Yes.
Okay,
Awesome.
excellent. Okay,
So I will move this over.
and just to let everybody know, this is being recorded, so you'll be able to go back and listen to it later. I'll have it on the website. Okay. Oh, that's her screen. Yeah.
All right.
Okay.
Are you able to see it okay?
Yeah. Yes.
All right. Okay, I'll get started then. And also with me here, Maribel, are you here? You want to introduce yourself real quick before I start the presentation?
Yes, good afternoon, everyone. My name is Maribel Castañeda, and I am a senior program specialist with the Community Outreach Branch. And my role is to provide support to our team as well as the community, partners, community-based organizations, and anyone that conducts business with the Department of Public Social Services Self-Sufficiency Division.
Thank you, Maribel. So what we will share with you today, and we will share this PowerPoint presentation as well, so you have it handy in case you want to share it with anyone in the community or in your community. So we will talk about the community outreach branch, the different Hemet outreach efforts we've done in the past year, and also just a high-level overview of the different programs and services that we offer with DPSS Self-Sufficiency, and then Benefits Cal, which is our online website where you can apply for benefits. So I am very proud of our community outreach branch team. It was established back in 2012, and really the goal is to enhance our public awareness, perception of DPSS program, and really also to reach areas where they don't have access to our district offices, right? Like a lot of unincorporated areas where there's no transportation available. So we go to those areas. In the past couple of years, we've procured our mobile van, which is really a mobile district office. We can do almost everything that an eligibility worker can do in the district office with our van. We can issue EBT cards, assist with an application, scan documents, anything that is needed for our programs. We also educate the community about the different programs and services that we offer. And we collaborate with community-based organization, public schools, colleges, any nonprofit agency, faith-based organization, collaborate with them to attend events or just share presentation like we're doing today. And then we also at times coordinate and administer grant activities for a program directly impacting Medi-Cal and CalFresh. So what have we done in Hemet? We've partnered with different agencies like RUHS, behavioral health, public health. I think what I remember from last year, we partnered with Hemet-PD, where they gathered adults that needed services, connecting them to veterans, connecting them to us. And so that was the Operation House sometime last year that we attended and provided support, any applications or renewals that they need. And then upcoming events we have, I want to share that in April, we are collaborating with Project Connect, April 20th. And then there's a mental health awareness fair in May that we will be participating as well. And what other outreach? Yes.
What are the dates in May?
May 9th in May.
And it's
Okay. And then other outreach efforts we're doing in Hemet. So we recently signed up for the Peach Jar portal, where we share flyers to school districts that have enrolled in that. So for all our families in the Hemet Unified School District, they receive this flyer that talks to them about Medi-Cal. How do they apply? How do they keep their Medi-Cal? And we just uploaded our bilingual flyer on March 10th. And this effort will go through the third quarter of 2024. And then I'm also sharing with you our DPSS program flyer, which we can share electronic copy via email along with the PowerPoint presentation. And it just shows our community how can they apply for our programs, where our different district offices are located throughout Riverside County. And Allison mentioned earlier that we have different programs that we offer. So they are CalWorks, where under CalWorks, we have the childcare program, employment services, and homeless assistance program. We also have general assistance, CalFresh, and Medi-Cal. So for CalWorks, this really is temporary cash assistance for needy families with children who have either lost their income or low income. And we provide them the basic needs that they need to get back on their feet and become self-sufficient. I'm going to kind of just go over this, and you have the PowerPoint slide if you need to refer back, but just want to give you a high-level overview of our programs. And this slide kind of just tells you the application process, what's needed, the interview, any verification that's needed to determine eligibility, and such as Social Security, income, and all that. And then we also have other cash assistance programs, such as cash assistance for refugee, trafficking and crime victims, human trafficking, and again, general assistance, which assists individuals with no children who have little to no income, and they need cash assistance to get back on their feet. Maribel, are you able to present? Are you able to see my screen or no?
Yes, can you hear me?
Yes, we can hear you.
Yes, thank you.
I'll hand it over to Maribel. Thank you.
Thank you. So the CalFresh program, it's also formerly known as the Food Stamps program or the SNAP program at federal level. So what the program does, it helps families or individuals purchase healthy foods, vegetables, fruits, or anything, that is covered under that program that is considered a healthy food item to stay healthy and away from the doctor. Eligible customers are issued benefits on an EBT card that they can use at any stores that accept EBT. As you can see at the bottom of the presentation, there is a CalFresh logo. So every time they accept EBT, there is the CalFresh logo saying EBT accepted. They can use this card to purchase food. It is income-based. So once the customers apply for benefits, they can be employed, they can be self-employed, working for someone else, receiving Social Security benefits, receiving child support, disability benefits. And the amount of benefits that they receive depends on their household, the payments that they make, and the deductions that we allow. We allow deductions such as rent, utilities, any childcare or disabled adult expenses, medical expenses for individuals with a disability, and also for those that are looking for work or working and need childcare. Next slide, please. Here, the slide explains the process. We have 30 days to process regular CalFresh applications, but for the population that it's in need and they are either homeless or don't have enough food to survive, then we have expedited services, which is 3 days from the date of the application. The application process, it can be done by telephone, in person at any of the 13 district offices that we provided before, at one of the outreach events that we have throughout Riverside County, or they can also do it online by contacting their county of residence via BenefitsCal, which is the application portal that we utilize in Riverside County. Once an application is provided, applicants may be required to provide some type of verification depending on the information they provided. That information can be either their income or citizenship status or any type of expenses that they reported on their application. Next slide, please. And then again, the card that you can see is the EBT card that is issued to customers. The EBT card has an identifier for CalFresh benefits, which means that they can only use it to buy food. They cannot use it to buy anything else that is not a food-related product. And the EBT card is accepted at local markets. We also have a market match program. They can use it at online stores. And even with their EBT card, families can obtain discounts to amusement parks or museums. So they can also take their kids, when they are on vacation. Next slide, please. And as I did mention, the CalFresh EBT card also has additional benefits. One is the market match program. The market match program means that if the customer purchases food at any farmer's market in Riverside County that participates in the market match program, they will be charged, for example, $15 into their EBT card. And in exchange, they will receive $30 in vouchers or tokens to purchase food at that specific market. And they can do it on a daily, like if the market operates on Wednesdays and then again on Sunday, they can do it 2 times. So that will increase their buying power for healthy food. And then also the restaurant meal programs is part of the EBT basically benefit, and it's for individuals 60 and over, or for those that are homeless, where they can purchase hot meals either from a restaurant or from a market that has hot food. So they can use their card also. And we have a list of all the participating restaurants in Riverside County. It's in our website at ripco.dpss.org. Or they can identify the participating restaurants by the advertising on their door. Next slide, please. As any other program, the CalFresh program also has reporting requirements, and there's 2 types of requirements for families, but also one thing that we want to keep in mind that is that for our seniors, they don't have any reporting responsibilities, and their annual recertification is done every 2 years. So this is something that the program has to benefit our senior population. Next slide, please. Medical. So medical is basically the public health insurance program. It's for anyone who resides in the state of California, regardless of their age, gender, disability status, or household composition. The medical program provides emergency service, preventive services, some dental work, and some vision work for children also. Having medical really benefits families because it allows kids to attend school if they are not sick. It allows our seniors to stay home and avoid trips to the hospital. So under the medical umbrella, there is many different benefits that are attached to them, and they each one come with the plan that the customer selects. Next slide, please.
Can
And
I-
there's a, yes,
Can you go back 2 slides?
2 slides? Yes.
Maybe one more.
One more.
Was this a slide? Okay, so you said 60 and above.
Yes.
What makes a person who's over 60 not qualify for this? We have a lot of residents, a lot of elderly residents in the city of Hemet that I would imagine would qualify for some type of assistance like this, especially with everything kind of going up and them not able to purchase medication and stuff. What would keep them from qualifying?
Are we talking about the restaurant meal program?
Or CalFresh, the CalFresh benefits.
Restaurant meal program?
You know, because like for example, if I asked if you guys went to one of these 55 plus neighborhoods, there were people that were over 60 that were able to, that said that they could use something like this, what would disqualify them from a program like this? Just making too much, like what if they
Making too much
Income.
money?
Yeah,
Right.
income.
what's
Right.
what's the monthly income that they to be able to qualify for something like this?
It will be a range in income depending on the household size, but it is based on federal poverty level. And we start from 130% up to 200%, depending on the household. And each household is different depending on the type of income that they received and the type of deductions that is reported to the county. And our message really to the community when we are out there is to let them know to apply. We have our eligibility technicians are trained to do that, to look into your income, to look into every detail of the application to see what will benefit our customers. And that's the reason why we also have the community outreach branch into the community, because a lot of times customers made their own determinations thinking that they are not going to qualify for these programs. Or even if the amount of money they receive is very little, especially in our senior community. A lot of times the feedback that we get is, well, I'm only going to be receiving $40 a month. But $40 a month is a lot of money at the end of the year. It's almost $500. And then they don't have any reporting requirements, any 6 months reporting requirements. They don't do redeterminations every year. So it is an advantage for them to know about the rules and how they can apply for these programs that are available to them.
Yeah, and just to add to that, one great thing, when we do identify that customers aren't eligible to our programs, just having them present and working with them, we're able to connect them to our partners in other divisions or departments that may have programs that are available to them that they wouldn't have otherwise known about. So it's a great opportunity even just to link them up to other opportunities for assistance.
Okay. All right, Allison, I'm gonna probably have you come out and do a couple meet at these 55 plus neighborhoods, because they have like a central room they could all meet at.
Absolutely. And especially with that population, in addition to the CalFresh and the food assistance, is, as Maribel was going over, is the Medi-Cal, and many of them not realizing that we can help offset some of their Medicare costs and things of that nature. So it's a great educational opportunity for them.
Okay. Thanks, guys.
And Malcolm, just to add to what you said, on the information that Joy previously presented, we have assisted to some of these communities. Some of the events are organized by the social worker who is at the either apartment complex or facility. We're invited to come over to present. We do a quick, 15-minute presentation to the citizens, and then we give them one-on-one assistance on how to apply for those programs. And, we will be more than happy to connect with you and to reach out to more members of your community. Okay, so there is a group of individuals that are already enrolled into medical. There is no need to complete a separate medical application. Those are individuals who are enrolled in SSI, CalWorks, which is cash assistance, refugee assistance, foster care, adoptions assistance, or King Gap. However, individuals that are enrolled into SSI and are paying into Medicare, we can also help them offset the cost of their Medicare if they apply for medical benefits. We'll assume that responsibility through one of the Medicare supplemental programs that we offer. Next slide, please.
What's Kin Gap?
King Gap is when there is a court order for someone to manage the affairs of an individual that is under the court guardianship.
Like if they have a conservator?
Pretty much it's on that umbrella. It's kind of like under the foster care umbrella. Joy, I'm not too familiar with King Gap, but I know that's kind of like how it works. They are under the guardianship of someone else, and someone is acting on their behalf because they're not able to handle their own affairs.
Okay.
And you know, any questions that you have, Malcolm, I can extend and send an email later on, giving you an explanation on what it means. That way you're satisfied with the response we provide.
My understanding is the same, Maribel, for the Kin Gap program is a relative, right, that's been given that ability to care for the children. But we can provide a clear definition of that. So we provide accurate information.
Right, to the next slide. And then the eligibility criteria for medical, basically the first step is to apply. To be potentially for medical, you know, individuals or families must meet one of the requirements, which is be California residents, provide tax household, which means what is their plan tax household status when filing their income taxes next year. Then income must be within the federal poverty levels. And again, you know, that depends upon the household composition. It can go from 138% up to 300% of the federal poverty level, depending on the age or the situation of each family. So if you're an adult, it can be 138 if you're single, but it can go up to 300 if you're a child and you are under the age of 1 or under the age of 19. And then, you know, if your income is above the limit, then we have another program that provides a share of cost, and then you must have linkage to that program. The linkage is to be either considered a child over 65 or a pregnant individual. Okay. Thank you. And then again, the application process is 45 days. For regular applications, there are customers that will have no linkage to the program, but who claim a disability. We also help them complete an disability determination through the state of California. We provide all the paperwork that they need, and then we send the information to the state. Once the state does a determination, we connect them to Social Security so they can apply for any income that is available to them while they are already receiving medical benefits. Anyone who is approved for medical benefits also receive a benefit ID card, as the one that you can see on the screen right now. It provides information about the customer. Anyone that is approved for medical is also required to enroll into a managed care plan. In Riverside County, we have 3 managed care plans. I'm sure that you heard about IHP, Molina, and Kaiser. So once they are enrolled, they have 60 days to complete a plan selection and select a primary care provider. Each plan offers different benefits to the customers, and we do not work on plan selection. We help the customer connect to the proper organization who can help them, you know, complete their forms or select a plan, but everyone will select one that will meet their own needs. Next slide, please. And then to apply for medical or any of the programs is if you're applying for medical only, you can do it through our online platform, which is benefitcals.com, or through Cover California. by telephone, calling our interactive voice response system at 877-410-8827 or visiting one of the local DPSS offices. However, we encourage our customers to also use BenefitScal, because by using BenefitScal, they have access to their application, but they also have access to the status and then also their disposition of the case. And especially if we are helping individuals who need access to other services, a lot of times they need verification that they are receiving self-sufficiency program, and they need verification. So with BenefitScal, they don't need to go into the office. They can pull their own verification from their phone, computer, tablet, and provide that information to housing or any other department that is working with low-income individuals. Next slide, please. And then Medical has reporting requirements, but the reporting requirements is part of the customer's responsibility. The customer has the responsibility to notify the department of any change that happen in their immigration status, pregnancy, any changes in their home, even if they're moving. One benefit of the program is that if you are moving from one county to another, they don't need to reapply for benefits. We can initiate a transfer, so there is no break in benefits, and the customer can access services in their new county of residence. Then, if their tax filing changes, then we also need to be notified of that. There is a 1 year requirement to complete a determination. And that's it. We keep the community also informed by the flyer that you see. That's available also for our customers and for our partners to be aware of the information that they need to do, and also when they need to complete a determination pack. Next slide, please. And then BenefitScal, as I mentioned before, is the online platform. Some of the benefits is customers can apply for benefits, submit forms, complete eligibility renewal forms, report changes, receive messages from their worker, also reminders when their determination is due or the report is due. They get the same type of benefits also by calling the 877-410-8827 number, which is our interactive voice response system. They will be able to get all that case information without the need to speak into a caseworker if they have their information ready available when making the phone call. And next slide, please. And then we also have available training videos for people who wants to use the BenefitScal portal. We have a BenefitScal channel, and it shows customers how to create an account, how to apply for benefits, how to link a case if they already have an existing account, how to upload documents, or how to report changes and do the renewal. We also have that option available for community-based organizations that help our customers connect to services. We grant them access so they can assist the customers and keep track of the applications that they have submitted to our county.
I was going to ask you about that, because I know with like for example with Dell, you can get permission to sell their products on behalf of them. And so I was wondering if you guys had something like, for example, we have a committee that has their heart for the homeless. And so if we were able to, if some of our committee members were able to get trained by you guys and they went out to go help the homeless, whether that was through feeding them or giving them clothes, would we be in a position where we could help them get signed up for some of these benefits?
We definitely can. We can sign them up as a community-based organization so they can assist the customers with their application.
So it's more like assisting, not actually walking them through it like a social worker would.
Well, you will do that when we give you access. It's up to the customer to share their information with you. You will be submitting all their information through the portal. You will be submitting that application on their behalf, and you will be able also to see if the application was accepted by the county. And once we do that, we also have additional training video. I would recommend, if this is something that you are interested in, to watch the community-based organization video. It's only 14 minutes. and it gives you an overview of everything that is available in our system. Once you watch the video, if this is something that you decide, then you can visit the Benefits Cal website and select, I want to become a CBO, and then on the back end, our department or division will receive your request, will review it, and then we'll work with you to give you the access.
Okay. And then I don't know if this is in the future in your presentation, but do you have something that has benefits that it helps cover the cost when we encounter someone who's homeless, who had their like documents stolen? They need to get, so you guys are talking about uploading documents, but what if they don't have their social security card anymore, their birth, what if they don't have access to those things? So how do we get them if they don't have the money to pay for those items?
I can take that. So we do have, if they are receiving our program, they can have the low to no cost. If they need to get an ID from DMV, we can provide them with a form stating that they're receiving benefits, and so they can get their ID at no cost or very low cost replacement. As for Social Security, we do not have, not that I'm aware of, Allison or Maribel. I think that would be something that they have to go to Social Security for.
Yeah, well, normally what happens when we have individuals come in and they are lacking documentation that's required, we'll work with them and assist them on how to apply. Our district offices do have what we call resource rooms available, and there's computers in there and we have staff in there. So if they need to apply for something maybe online, and our staff are there to walk them through that, we can do that. So a missing Social Security card,
any vital records.
Yes, so we're definitely there to assist them through that process.
Okay.
And Malcolm, I just want to say that there are programs, as the medical program, where we do not require a birth certificate if the customer completes, the application to the best of their knowledge, and we are able to verify their information at the federal level. We will not be asking the customer to provide a birth certificate. So there is, and that's the reason, again, where I want to, reinforce that our eligibility technicians are trained to do the most that we can on the back end. That way the customer receive the very minimum request for verifications. Okay. And then do you want to take awareness, Joy?
Yes, so just a few things that we want to make everyone aware is that there is an app called Hemet-SJ. So if you are receiving CalFresh or CalWorks, you have your EBT card, you download the application and you can have access to look at the balance on your card. Also the ability to freeze your card or request for a replacement card if you've lost your card and you want to make sure that nobody is using it. It's a great application to have on the phone to just even check your balances, so you don't have to make that phone call. And then another thing we want to share is that if you want to know of any upcoming events where our van is going to be at or our team's going to be at for the community outreach, we do have a section on the DPSS website. Click on events and you'll see where we're going to be in the next few weeks. And that is it. That is the end of our presentation. We have our contact information on the slide as well if you need to reach us, and we'll open it up for any other questions you have. Or Allison, I'll turn it back to you.
Thank you, Joy and Maribel. And we really wanted to take an opportunity just to kind of educate you a little bit about the programs. I think that, allows for you all to see better where we would fit in to your community events. So Malcolm, you kind of nailed it when you said like, oh, so this would be a great presentation, or these program awareness opportunities with our aged population. You may see some of these programs now that you have a little bit more information where we would be of great benefit to come in and offer education and awareness, whether it be at a school event or if you have an actual city, health fair, things of that nature. You're always welcome to reach out to me, to Joy, Marival, and let us know what events are out there. We try to get our van. We have 2 vans, and we are in the process of, hopefully, fingers crossed, procuring 2 more. They are of high demand because we are able to conduct the interviews and issue benefits out in the community. But when we're not able to take our vans, we still have our staff with laptops and all of our information available. And so we take the more kind of tabletop approach when we don't have the vans there. But I mean, really, any time that you guys think that our assistance in the community would be beneficial, we thrive on that. As we started the presentation out, you know, we look at our hard to reach customers. We know that many of the people in the community are either unaware or often face a lot of hurdles, right? Just getting to an office and not realizing there's other ways that we can assist them. So yeah, I'm gonna open it up for any questions that you might have for us.
There was a question that was brought up that if are we allowed to advertise you on our website? Advertise, you know, or put a link to some of these programs.
Yeah, absolutely. I mean, if you can put a link to the Riverside County DPSS intranet site, because then it also opens it up. We have our, like I mentioned, our adult services and children's services, which have some other programs that people might not be aware of. We recently had a kind of a facelift on there, so it's easy to navigate with both like visual icons and links to all of the program information and application portals. So that would be excellent.
Okay, we do have a page on our website for resources. We can definitely put it there.
Okay. Any other questions?
Yeah, I do have a question. My name is Phoebe from Alternative Twist Radio. We're not quite members yet of the Human Relations Council, but we're working on that. But as far as, you know, I follow different resources online for County of Riverside, and I do follow you guys online on social media also. And I noticed that County of Riverside, they posted job openings. And I think this is part of my past job training too. I always look for resources through the area. So I know a couple of people, friends, that mentioned to me, they saw that you guys are hiring for eligibility technicians. So I don't know if this is quite related to community outreach or not, but maybe you know. Are you guys still hiring for that position? Did you guys hire? You know, because I know a couple of people who mentioned to me that they applied for the jobs and they just like happened to mention it to me. Are you guys still hiring for that position and other positions available?
I will say yes. So we do have various positions that are a consistent kind of open recruitment. We try to maintain lists so that when we're ready to hire, we already have candidates who have submitted those applications, and it makes it a bit more efficient. Other times it is just really based on when we have openings. What I would recommend for any individual who's interested in county employment, in the Human Resources website page is the opportunity to sign up for job and opening announcements. And you can sign up based on what you're interested in. And so it maybe if you're interested in like the social services, social worker eligibility kind of realm, then you can sign up to get notifications to yourself when those open up so that people don't miss that opportunity.
Yeah,
Allison, I just want to add one thing. We actually have a career fair for eligibility technician 1 and 2. It's going to be on Zoom on April 9th. I can share this document with you guys on the chat or email, whichever is easier, but it's on April 9th via Zoom.
If you'd like to put that in the chat, that's fine. That way I'll have a documentation of it if anybody needs to come back to it.
Any other questions? Nothing. Nothing.
So I think Malcolm, you answered, no, you asked the question I wanted to know, because I know a lot of people who don't have a house, have lost a lot of their documentation, social security cards, and driver's license, and the veterans have lost their DD 214s, and they don't have that kind of documentation anymore. And that's very often a real stumbling block for them. So if there is assistance to be able to get those things, that's wonderful. I love the idea of the low to no cost driver's license. I didn't know that existed.
Yeah, and a great example as to why we have this team. It's a lot of information, a lot of programs, and so it's, you know, our honor to be able to be not just here today, but at any of your events where we can help educate the community. Is an opportunity that, you know, we look forward to, because our services are, I mean, detrimental to health, you know, just the well-being, safety of our communities, and it
Sure.
means a lot to us to be able to get that out there.
I do have another question. I know in dealing with the homeless community, there was an issue I know from women with children who got food stamps, but not very much cash assistance, because the food stamps didn't cover things like diapers and, you know, and household things like toilet paper and paper towels and the kind of stuff that you would not think about until you know you don't have it. And so I know, especially the diapers, that was diapers and wipes, you know, they need those all the time. And so is there anything changed in that?
No,
yeah.
for the, oh, sorry, Alison, go ahead.
No, you are the subject matter expert on this one. You take it away, Maribel.
So I was going to say that with the food stamps program or CalFresh, they cannot purchase anything that it's not food related. But
Right.
for customers who are receiving cash assistance and they have an EBT that is cash based, they can purchase those items with that EBT cash base. So
Oh, okay.
yes, and each car is coded, even though they look the same, they are coded different. So sometimes you can see, you know, people purchasing different items at the store. And, you know, from experience, again, by being out in the community, we have customers saying, hey, wait a minute, why someone was able to, you know, purchase this? And I
Sure.
tried and I can. Well, it's food-based and cash-based. For those cash-based, they can buy paper, supplies, anything that they need.
Okay.
And also, I know there is other, you know, programs like I said, you know, I recommend that you follow us on our website, because sometimes we attend events that are for mothers where they are doing diaper giveaways, you know, milk, things that are not covered by WIC. Which
Right.
is something that I kind of like forgot to mention, that anyone who's receiving benefits from medical or CalFresh doesn't need to do an eligibility determination for the WIC program. When they apply
Okay.
for the WIC program, they are asked if they are receiving any of those programs, and if the customer states yes, then their eligibility to WIC is automatic. There is no
Right.
separate application.
Okay. Okay. That's important to know, because it's amazing how many women with children are out there.
Yes, and we will also be sharing one of our flyers for the CFED program that is also under CalFresh. It helps customers who are receiving CalFresh benefits with school supplies if they're attending schools, you know, work boots, uniforms, resume assistance if they are looking for a job. So that's one of the flyers that we also carry with us, and we can share that with you via PDF.
Okay. Yeah. If those get sent to us, we'll get them on our website, just as a link.
And then can you guys talk about the program and help me if I'm wrong, but there's a program if you have CalFresh that you can help with like rental assistance as far as the first and last rent to get them in? Is that something you guys have?
So this would be our CalWorks program. And our CalWorks program does have components to it, which we do have a housing support program. And it really is, based on individual family needs, but we do assess their situation. And our goal is obviously to prevent eviction and homelessness. Oftentimes people come to us and they're already in that state, but we do look at how we can help them. That could, as you said, Malcolm, include rental assistance, the kind of coverage for just moving in. It may assist with some furniture, just really dependent on an individual's needs, which is why we say if a family thinks that they're in need, is to apply. Let us take a look at what we can do for them.
So that one on the one slide where it said, I think it said benefits Cal. Is that like would you call that like a central hub? If a person signed up on that part, then it kind of connects them to maybe a bunch of other stuff that they might be eligible for? Or is that something that they sign up for to kind of monitor their own paperwork stuff?
They would choose the program that they want to apply for. So they can apply for CalWorks, which includes, when they apply for CalWorks, like what Maribel shared earlier, it will also apply for CalFresh and Medi-Cal, kind of like all in one. And then they can apply for CalFresh by itself and then Medi-Cal by itself, but they would have to select.
Okay. When people sign up for things, is there something in your system that triggers, oh, this person might be eligible for this thing? And does someone like follow up on that to ask those people? Or is it the people have to do their own due diligence on finding out if there's more that they could be getting that they may not be aware of?
Yeah, applying through Benefits Cal immediately interfaces with our system, and the next day we begin the process of contacting the customer to follow through on that application. Benefits Cal, and just to add, is also a portal where customers can self-service. I don't think we went all the way through that side, but they can submit documents, check their benefits. It's just a customer portal, but we do receive the application on our side. They don't have to do anything after that.
So I think, Malcolm, what you're looking for is if a customer comes into the office and they are expressing that they want to apply for, housing or maybe behavioral health or food, if we do all those connections, right?
Yeah.
So for us, when we have, and again, I'm speaking about the community outreach branch, when we face customers in a community, depending on the customer need, we connect them to services, but we connect them into indirect referral. We give you the information so you can apply for those programs on your own. So if we have someone that is saying, I am homeless and maybe how do I get Section 8 assistance? Then we let them know, okay, visit the website. We have, housing authority, someone who says I need a care provider because I'm not able to meet my own needs. Then we provide the telephone number so they can go to the DPSS Adult Services Division and apply for in-home supportive services. Or someone who may need to go to Social Security, right? Then we send them to myssa.gov. We don't connect them, we don't do a warm transfer, but we do provide that information. And then we also guide them to 211. I'm sure everyone is familiar with 211. It's only a phone or a click away, and the customer can search for information based on their needs.
And I do want to add to that, though, really quickly, Malcolm, because the County of Riverside is in the process of launching our integrated services model. And integrated services is something like very near and dear to our hearts, and our DPSS team is participating on that now. And that is the ultimate goal, where a customer can access our county from any entry point, and based on their needs, we do make that connection for them and not so much a referral. So we are piloting integrated services in our life office right now for us, for self-sufficiency, but Our adult services is testing it in Paris. And then each of our Riverside Unified Health Services, our county hospital has clinics. And our Harupa clinic is testing that for when patients come in through the clinic. So looking at various different channels of entry and how we can, when someone comes in, do a full assessment of their needs and then make that connection. So a lot of work being done there, because we do see that can be challenging to get a list of here's other places you can go and contact, rather than let us help you make that connection. So big initiative that we're launching and participating in right now.
Thank you.
I'd like to make a comment, and my comment is this. I've helped people for a lot of years connect with DPSS and other county organizations, and I really applaud the idea that you're now calling them customers instead of clients or participants or applicants or all those things. Calling them customers is a beautiful, dignified way to refer to the people you work with. Thank you.
Thank you.
Agree. Any other questions?
So I have a couple examples that I just want to make sure so that I understand what the service is. Two examples that I'm familiar with that I've heard about. Someone goes online and they apply for benefits on Social Security, not a lot of health issues on Medicare, and just say you're not going to qualify. The next step to that, would the best thing be to make a phone call, and just, I just went online and this is what it told me.
Ms.
So
Parker.
and I'm sorry, I don't know the particulars, but that's what I was familiar with.
So one thing that I was saving for the end is effective January 1st, 2024. The medical program doesn't have a property requirement. Assets, property, it's been disregarded. So maybe in the past, prior to January 1st of 2024, if anyone was over the property limit for medical, they were denied benefits. And we understand, especially, our senior community, I'm already saving for my future because I don't know what my future looks like. So I wanted to keep money in a bank account, and then I apply for a medical and they tell me I'm not eligible because I'm saving for my rent. So effective January 1st, 2024, all that is gone. As long as you have linkage to the program, you will be eligible to receive benefits. However, they may not be free. You may have a share of costs, but having that medical, even with a share of costs, it gives you a cushion for anything that is not covered under Medicare, because Medicare only covers for 30 days in a hospital. Well, what if you stay longer than 30 days in a hospital and you get a huge bill for, $60,000, and then your medical share of cost is only $5,000? Well, I'd rather pay my $5,000 than give my $60,000 or pull a second mortgage on my house because I need to pay for my health benefits. So, beginning January 1st, 2024, that's one of the big, expansions that we received. And we have been announcing it to the community, to our partners, to everyone, because like I said, it really opened the door to our senior community, and we're very happy about that.
By the way, 2 days in the hospital was $70,000.
Yeah. So
Okay.
Well, it depends if you do a facelift, I guess that would cost you.
That would. But one thing that made me think of is, again, if people aren't sure, definitely give us a call. Definitely apply. One thing with Medi-Cal is we are able to look retroactively. So sometimes people come to us because they have been in the hospital and now have a bill, and we are able to look back a couple of months to see if we can cover that. So just, again, there's so many different little nuances to the programs. Yeah. And that's why we try to get ourselves out there in the community, do presentations like this, or just tell people, give us a call, or if they come directly to you, please feel free to email us, and we'll connect them with a staff member to help out.
Okay. One other situation that I'm familiar with, and always keeping in mind, we want people to learn to take care of themselves and follow up and do their own phone calling, do their own stuff independently. But if there's no opportunity for transportation, I've had those refusals in the past, have a history that they're concerned they're going to be red flagged. What's the best, like maybe incarcerated at some point. So they just don't want it. They just know they're going to be turned down. What's the best way to approach that? Where they can contact, would they be able to get transportation or someone go to their home or anything like that?
Well, one of the options we offer is our interactive voice response system, which if they call the 877-410-8827, they can apply via telephone. So they don't have to leave their home if they are in need of applying for benefits. We can mail an application to their home, or we can take the application over the telephone for, some of our programs. So the customer doesn't necessarily have to leave their house. It can be, due to an illness, or again, lack of transportation, or to some, different status where they cannot leave their home. But that's the option that it's available to us. And we'll go ahead and put the number also on the chat, so you can have it available to share with your customers. But our informational brochures and flyers have that information. We call it self-service options, where they don't have to leave their home to connect with us.
Okay, thank you.
Thank you.
Thank you.
If there are no further questions, no further questions?
I don't think so. I don't see any here.
Okay. Well, we appreciate you, Miss Allison, Maribel, and Mary,
Enjoy.
you guys, for your presentation. It was very informative.
Thank you.
Thank you very much.
Thank you for having us.
And you know how to reach us if you have any questions. So we appreciate the opportunity. Thank you.
And if you guys have any extra resources that you can email me, I can email it to the rest of the group.
We will do that.
But if it's okay with everyone, we can go ahead and close this meeting.
Thank you, everybody. Have a
Thank
great
you.
evening.
Thank you.
Bye.
Thank you.
Thank you very much.
Bye-bye.